Have you ever experienced a burning sensation in your chest after eating? Acid coming back into your throat? Or frequent heartburn that just won't go away? What if one tablet could provide relief for up to 24 hours? Today we're taking a closer look at Pyrocalm Control 20 milligrams. But before you use it, there are a few important things you need to know. Welcome to Medzy Health. In this video, we'll explain what Pyrocalm Control is, how it works, its benefits, possible side effects, and who should or shouldn't take it. First, what exactly is Pyrocalm Control? Pyrocalm Control contains Omeprazole 20 milligrams, a medicine known as a proton pump inhibitor, or PPI. It works by reducing the amount of acid your stomach produces. Unlike antacids that neutralize acid already in your stomach, omeprazole helps prevent acid from being produced in the first place. This makes it effective for people who experience frequent heartburn or acid reflux. So, how does it work? Inside your stomach are tiny pumps that produce stomach acid. Omeprazole blocks these pumps, reducing acid production for up to 24 hours. However, it doesn't work instantly. Many people start feeling better after 1 to 3 days of regular use, so don't expect immediate relief after the first tablet. What are the benefits? Pyrocalm Control may help relieve frequent heartburn, reduce acid reflux symptoms, protect the esophagus from acid damage, improve sleep by reducing nighttime reflux, and provide a long-lasting acid control with just 1 tablet a day. Now, here's something many people don't know. Taking more tablets won't make it work faster. In fact, using omeprazole for longer than recommended without medical advice may increase the risk of problems such as vitamin B12 deficiency, low magnesium levels, bone fractures in some people, or certain stomach infections. Let's talk about side effects. Most people tolerate omeprazole well. However, some may experience headache, stomach pain, nausea, diarrhea, constipation, or gas. Serious side effects are uncommon but require medical attention if they occur. Who should avoid using it? People who are allergic to omeprazole or other proton pump inhibitors should not take it. If you have severe liver disease, unexplained weight loss, difficulty swallowing, vomiting blood, or black stools, seek medical evaluation instead of self-treating with acid-reducing medicines. If you're pregnant, breastfeeding, or taking prescription medicines such as clopidogrel, always speak with your healthcare provider before using omeprazole. So, is Pyrocalm Control worth using? If you experience frequent heartburn or acid reflux, omeprazole can be an effective treatment when used as directed. But remember, medicines work best when combined with healthy habits. Avoid overeating, reduce spicy and fatty foods if they trigger symptoms, don't lie down immediately after meals, maintain a healthy weight, and avoid smoking if applicable. The bottom line is simple. Pyrocalm Control can help manage acid reflux, but persistent or severe symptoms should always be evaluated by a healthcare professional. If you found this video helpful, don't forget to subscribe to Medzy Health for more honest medicine reviews and easy-to-understand health information. Thanks for watching, and I'll see you in the next video.